Hi everyone, welcome to the PowerPoint on adolescents who are experiencing the dying process or grieving the death of someone close to them. I've organized this PowerPoint similarly to the PowerPoint on children. So first we'll talk about developmental contexts, then the needs of dying adolescents, and then teens and grief. All right, developmental tasks and adolescents' understanding of death and dying. So in terms of what's happening during adolescence, I just want to kind of situate you in adolescent development. Some of you have had this before, some of you have not. Either way, it's not on the exam, but I just want it to kind of come to your attention. So in terms of, we'll talk about social and emotional development on this slide and then cognitive development on the next. So in terms of social and emotional development, adolescents are in a time of increased emphasis on peers. And so they're maybe seeking support from peers if they're grieving or going through the dying process. Teen support groups can be particularly useful at this time of life. And yet adolescents are also fearful of seeming different from their peers. And so they might be worrying about being the kid that has cancer or showing their grief. This is also a time where already in adolescence you're having a lot of non-death normative losses, and I bet you can think of even more than I'm going to mention. But anytime we have transitions, which we have a lot of during adolescence, then we have losses. So any transitions between schools, moving, or parents divorcing, or siblings maybe leaving home, our own kind of graduation from high school, just the way that we kind of tend to lose our sense of being a kid, our childhood roles, and that increased responsibility that comes in adolescence. So anything that we're experiencing, whether it's a terminal illness or the death of someone close to us, is coming within the context of already non-death losses. This is a time, right, of increased autonomy and independence. It's a developmental drive. Yet at the same time, if you're going through something tough, you are unable to cope alone, and so you might be kind of feeling this, we'll talk about this more, this kind of desire to move away from family, this desire to move towards family. Adolescents in terms of identity development are really, one of our tasks during adolescence is to develop a sense of self. So if we have a terminal illness, how's that fitting into our identity? Are we struggling to be known as something other than, the girl with cancer? And then we also often create our identities in reaction to those around us, siblings, peers, parents. And so if we lose somebody close to us, it often kind of feels like a threat in some ways, or it's shaking up our identity. This is a time of increased spontaneity, so we'll see that that might manifest in how adolescents cope with grief, for example. And it's already a time of more emotional extremes, more ups and downs. And so putting kind of dying or grieving on top of that can be tough at this age. So adolescents are in formal operations compared to kids being in concrete operations. And so they are able to think more abstractly about death, kind of do more of that searching for meaning, whether that's, just general questions or religious or spiritual questioning. So for example, whereas kids are asking more concrete questions like, what do people look like when they die? Adolescents might be saying, how do we prepare people for death? Or why do we treat someone when we know they're going to die anyway, right? So more kind of complex, abstract questions. You may have already learned about adolescent egocentrism, right? This kind of overfocus on the self. Which is totally normal. And the two most famous components of that are imaginary audience and personal fable. So imaginary audience is that belief that everybody's watching me and talking about me and noticing. So everybody's talking about the fact that I had to have brain surgery, or everybody is talking about the fact that my brother died. Everybody can tell that I'm crying at school. So that's imaginary audience. And then personal fable is kind of that I'm so special, I'm so unique, which I still think I have a little bit of myself, but that means that there's kind of three ways that affects adolescents. One is that they feel like when they're in pain, no one can understand it. which puts them at risk for isolation, depression, suicidality. They also are more likely to think that bad things aren't going to happen to them. So they can drive crazy or use substances or have unprotected sex, and bad things aren't going to happen. And so, of course, when they do, either to them or someone close to them, that can really rock that personal fable. And then the last one is just maybe a little less relevant to death and dying, but just thinking that you could be maybe more amazing or famous than you're probably going to be. Like, I'm going to be an NBA star or something like that. So in terms of adolescents' understanding of death, they've resolved those cognitive limitations that younger kids have. So they understand death is universal, final, right? They also know that it's a personal experience. Everybody's going to react differently to losing, either going through the dying process or having someone close to them die. They more realistically understand what causes death, less likely to make up kind of magical reasons. They might be more interested in kind of causality and thoughts about afterlife. They might be starting to have realizations. You know, one of my changes that happened to me in adolescence was realizing that not everybody believed in heaven. You know, I can remember making an offhand comment to my friend Amanda in 11th grade, something about heaven. And she said, "Do you believe in heaven? Wow, that's so nice. I wish I believed in that. It sounds comforting." And it was like such a shock to me that, not everybody believed in heaven. And then, yes, this idea that you now, with your cognitive abilities in formal operations, as an adolescent, you can think more complexly, you can think more deeply, but you have less experience doing so. And so this ties back to what we talked about at the very beginning of the semester, that adolescents are at a peak time for death anxiety. Okay, let's turn our attention to the needs of dying adolescents. Okay, so in terms of experiencing the death of a peer during adolescence, you can see that the top 3 reasons why adolescents die are all sudden and traumatic death. So that's really difficult. That if you're having a friend die during this time, it's usually a traumatic and sudden death. The number 1 is unintentional injury, which is either automobile accidents or accidental overdose. And then you can see the next 2, homicide or suicide. They kind of move depending on whether we're talking ages 10 to 14 or 15 to 24. If adolescents are dying, then they are most likely to be dying from cancer, heart disease, or a congenital abnormality, something that they had, that they were born with, that's kind of catching up to them. Okay, so you can test yourself on this eye clicker. The leading cause of death during adolescence is accidents. And then on this one, I'm just wondering, did you or someone close to you growing up experience a life-threatening illness during adolescence? And so you might be thinking of that as we spend a couple of slides talking about supporting dying adolescents, and I'm always open to your ideas and examples. Okay, so here's some needs of dying adolescents, and you might be thinking as I talk these through, how could you acknowledge these or give permission for these needs? And I'll try to give some examples as well. So adolescents have, like we've talked about, this increased need for independence and control. Independence from parents, control over medical decision making. And for example, if this has been an adolescent struggling with this illness through childhood, then this can be a shift for them and their parents. Like suddenly, parents aren't just making medical decisions. The adolescent is making medical decisions. And suddenly, maybe they don't want the parents as involved all of the time. The challenge, of course, is that it's going to be that kind of almost like a rubber band or a yo-yo, where during kind of stressful times of crisis, adolescents are more likely to be relying on parents. And then when that abates, then they're more likely to be kind of moving away from parents. And so it can feel like a little bit of this push-pull. Parents can also have a hard time kind of figuring out, how involved to be. And so maybe you can just acknowledge that. Like, I'm guessing there's times where you really want your parents and times where you need your space from them, and that's okay, right? It's kind of an acknowledge and giving permission. At the same time, they need secure attachment, right? They need to know that there's people that they can count on, especially kind of parents and primary caregivers. So also you could add that in, I know that even though there's times where you want independence, you also it's so important to have them as a safety net. Personal identity. So adolescents are trying to define kind of who they are. And so this idea that, they might be wanting to express or explore, but if they're weak from an illness, that can kind of get in the way of their own identity development and exploration. And they're also trying to figure out how much to incorporate my patient identity or role, or my dying identity or role, my disease kind of identity into who I am. And maybe we're also recognizing that most of the time they're going to want to be known for more than just that. And I'll give you some examples of that coming up. Peer interaction. We've talked already about how peers are important. And so maybe if we are healthcare professionals, maybe we can, or hospital staff, maybe we can just bend the rules a little bit to allow to have friends in. Technology has certainly made it easier, but as health professionals or as caregivers, we want to be really helping them. So we could just say, I know that having connections to your friends is important, and I want to help facilitate that. So if I need to do some driving, or if you need, a different kind of technology, or we just need to prioritize that, I hope you'll, let me know. At the same time, if there's people that you don't want to see and you want me to protect you from them, I can do that too, right? In terms of privacy, so we had, maybe when they were younger, maybe there was not as much discussion about whether or not it was a male or a female staff member kind of taking care of them, but maybe now they have more opinions about that. Maybe it used to be that parents were in the room, and now maybe we're giving more permission. Like, who do you feel more comfortable with performing this procedure? Do you want your parents here or not? Would you like them to step out while we, would you like, so just more kind of giving permission and choices. Positive body image. This may seem, at any age kind of silly, but things that are important to adolescents are important to dying adolescents too. So tattoos, piercings, dyeing your hair, cutting your hair, can all be important things to do. We know that feeling good about how you look is a big predictor of self-esteem overall. And then, having opportunities to discuss concerns about the future, I'm guessing you're worrying about what's going to happen down the road, and how long you'll be able to be living, and what the dying process will look like. And I just want you to know that that's so hard, and I can handle talking about it when you want, but we don't have to if you don't want to, right? That kind of thing. Okay. So this was a program that a friend of mine developed, Rebecca Brown, at the University of Florida Shands Hospital. And it sounds like there are starting to be some other kind of types of things like this for adolescents within child life programs, maybe at children's hospitals. And so UF has a medical school. And so this program was a peer mentoring program with students who identified as pre-med, providing student companionship or providing companionship for adolescents who were terminally ill. And so it was this kind of just peer support, both in the hospital and maybe even coming out for visits when they were home, or following up over the phone or text. Some other things that this program did was just try to make those parts of the hospital with adolescents in it not just look like, like it's a little kid wing. So making a graffiti zone, a graffiti wall, and then allowing WIT to support that identity idea, helping teens make a collage representing themselves that could go on the outside of their door, so that people coming in can remember that they're just more than this kid with a heart defect, right? But that they have these passions or these interests, and maybe they'll talk to them about those things. This was a time when there was less technology, and so there was a whole cart with movies and music, but that might look different now. There was also a teen lounge where you could play video games or gather some, for special occasions such as birthdays, to help kind of celebrate. So you can watch a video clip if you're interested in seeing more. This is also Rebecca Brown's TED Talk. She's amazing. She's one of my most amazing mentors in my whole life. And so if you are interested in this area about supporting dying adolescents, I just highly recommend. She gives a lot of great examples and stories. Okay, so now we're going to talk about adolescence and grief and how to support grieving teens. And so again, I think there's a lot of you who experienced a really significant loss, death or non-death during adolescence. And so you can be thinking about what didn't work for you, what did work for you, and I'm always open to hearing those ideas. So what I've done is I've divided this part of the PowerPoint into first just focusing on the secondary losses associated with kind of three big losses: the death of a parent, the death of a sibling, and the death of a peer. And then we'll talk about the manifestations of grief again and which ones kind of stand out a lot during adolescence, and then we'll get into some specific kind of strategies for supporting grieving teens. So you remember the primary secondary losses, the primary loss being the death of a parent. I've listed some secondary losses here that I thought of and students have helped me think of over the years. But again, this can be something that we are just helping the adolescent who's had a parent die to name these, list these, normalize these, right? Grieve these very specific secondary losses. So I'll just read them out in case you're away from a screen. Loss of unconditional love, loss of identity and worldview, loss of a connection to your past, loss of a protector. Not all of us had unconditional love and protection from our parents, but sometimes hopefully we have that, and then of course we're missing that. The loss of all the future events that they won't be there for, weddings, graduations, births, just all the milestones, reunions, holidays. The potential loss of income and how that might affect the rest of the family. Students have also shared that when they've had a parent die, then sometimes they feel like they're losing the other parent emotionally because that parent is intensely grieving or financially stressed, and so it's the loss in some ways of both parents. Loss of just normalcy, right? How you used to move about the day, who you talked to and when, and who drove you places, and just all the ways that parents are kind of often standard figures in our lives. Of course, that can vary for us. And then perhaps the loss of a role model. Sometimes our parents are role models for us, or they are in some ways and not in others, but now we've been kind of using them as a guide, and we don't have that anymore. Okay, so then if we think about the death of a sibling, which I know hits home for some of you, again, here's some secondary losses that I've thought of that students have suggested. So again, that loss of someone that you've been creating your identity around. I know, for example, watching my younger daughter, she's really created her identity in reaction to her older brother. There's been ways that she's intentionally decided to be different than him, and ways that she's kind of decided to follow in his footsteps, and he's kind of laid the path for her. And so we can have things that we pulled from our personality or that they influenced our personality. And so then the loss of them just feels like there's this hole there. They also have a connection to our past. They also are someone that we maybe at worst had some camaraderie when nobody else was around, and at least kind of someone to keep us company or somebody to fight with. And maybe at best they're one of our attachment figures that we really turn to for support. We might have had activities that we used to do with them that now just don't feel the same, or we don't have somebody to do them with. And our parents, may have changed how they relate to us if we are one of their only or several surviving kids. So maybe our parents are so preoccupied with their grief that we're kind of invisible, or maybe there's suddenly a lot of pressure on us to be amazing, or to be really safe, or to live up to this amazing sibling that died. So it can also kind of change our role in our family system. So as we've talked about, the leading causes of death for adolescents are all sudden traumatic deaths. And so that means that if you're having a friend die, that's often how they're dying. So it's also considered at this age an off-time death. Sudden and traumatic deaths are more likely to lead to traumatic or complicated grief. They often have an element of feeling like they were preventable, which can lead to anger at the person who died, anger at ourselves for not doing more. And you'll see this kind of represented in the reading after a friend's death from this week. People might experience just a sense that life isn't as safe, maybe more fear, fear that other people will die by suicide, fear that someone else or themselves will die in car accidents. People might begin to change how they behave and interact with others based on, their friend's death. I've heard from students who've said after we lost a peer in high school to a car accident, we all just started holding each other accountable to drive really safe. Or after we had several peers die by suicide, we got really good at starting to check in on people's mental health. Our friends are definitely a part of our identity. They are often supports. They can be attachment figures as well. And so losing them can be, devastating. Or it could be that they weren't super close, but you're losing the friend group or the dynamic that you had, or you're losing who gave you a ride to soccer practice or to school. And it is that sense that they're similar to us. And so if it can happen to them, it's really kind of starting to threaten that personal fable that maybe it could be us as well. All right, so test yourself with this eye clicker. Unconditional love, most likely to be associated with the death of a parent. Not always, and could be others, but that would be the most likely answer. Okay, so a lot of the same manifestations that we talked about for adults still apply to adolescents, but I'll highlight some of the more prominent ones. So adolescents can be particularly prone to eating and sleeping difficulties because these are already happening at this time. Either not eating enough, loss of appetite, binge eating, eating too much, could contribute, for example, or exacerbate eating disorders. Sleeping is already tough during adolescence because changes in the sleep-wake cycle and sleep deprivation, insomnia, all associated with puberty. And so that can be intensified during this time. Just like adults, teens might experience decreased health, more likely to get sick, or, more likely to not be paying attention and get into an accident. Like kids, kind of having and adults, those kind of physical aches and pains, maybe the stomach aches, the headaches. And stressful events like death can influence the timing of puberty and the tempo of puberty. So it can happen sooner and it can happen faster. So people might just grow really fast, after, for example, the loss of a sibling. In terms of emotional manifestations, definitely that kind of numbing, minimizing, burying. I do think adolescents often don't know what to do with this level of pain. I mean, many people don't, but particularly when you're new to grief. And not wanting to seem, different. And so you might kind of push it down. With that personal fable, you end up feeling more alone, more increased risk of depression. We talked about this being a higher time of death anxiety and fear. Anger might be higher, particularly for males who feel pressure to be tough or stoic. You can feel resentment, like this is supposed to be a fun time of my life, right? Like what a great time, and now it's about loss and grief. Or maybe I'm resentful that I have to connect with my family when I'm wanting to be independent. And then, of course, you can feel guilty for feeling resentful or being angry or being withdrawn. Okay, so these first ones for intellectual are similar to kids, right? Struggling to pay attention or focus in school, concentrate, not keeping track of things. That all makes sense, similar to adults. We already talked about the cognitive phenomenon of egocentrism, right? And imaginary audience and personal fable. And we already talked about kind of those more abstract questionings, which often spill over into the spiritual manifestations, which might mean more increased religion, questioning religion, or beliefs, and just looking ways to make meaning about this person, about why they died, or where they are now, or how we're maintaining a connection with them or honoring them. Okay, so some of the behavioral or social manifestations of grief that we might see in adolescents are kind of that spontaneous behavior, maybe that comes out in using rituals or memorializing, like we're gonna make a music video this afternoon. Using substances to escape, experiencing that isolation due to personal fable or imaginary audience, seeking more support from peers, seeking more parental support during tough times, and maybe just even some attention-seeking behaviors, wanting people to know. Some people don't want anybody to know, how they're suffering, and other people might be kind of wanting to get some attention, either for the loss or just in general. And sometimes that's in good ways, and sometimes that's in bad ways. So here's some ideas for supporting grieving teens, either personally or professionally. So obviously just that kind of being a sounding board, using our communication skills to ask open-ended questions, to be curious, to normalize, to acknowledge, to use our self-disclosure, right? All of that to help kind of name the emotional manifestations of grief. And then, just like we do with other populations, brainstorming how they might want to use kind of rituals, things that might fit for them, based on the person who died, their talents, to honor them, kind of lean into the grief, make it active. Of course, teaching them about grief like we do everyone, helping them know that it's normal, modeling that for them, which might be, oh, I totally lost my temper with this sales clerk today, and I'm actually thinking it's just because I'm just mad. I'm mad that so-and-so died, or I'm mad that I'm having to grieve during what's supposed to be a happy time in my life. Helping them, it's already a stressful time, and so it can feel like, gosh, I'm grieving, and now I'm not doing well in school, and I've got all these other things, so we just might be needing to do some very kind of concrete, how to reduce stress, how to increase sleep, because we know once our sleep declines, generally our mental health declines, and sleep is already at risk during adolescence, so that can be a big one to really focus in on. So cutting back on the caffeine late in the day, right? Trying to sleep at night rather than during the day, those kinds of tips and tricks. We might need to help them think about how are they communicating at school? Does anybody else, like an adult, need to step in and communicate with teachers or counselors? As much as we can continue, like with little kids, having consistent responsibilities and routines, just still doing chores and, still, hopefully having, maybe we're getting to have dinner or doing the things that we try to do as a family. Keeping track with of those internalizing and externalizing behaviors that can spike in adolescence. So we're trying to check in and monitor for depression, anxiety, and eating disorders in particular in the internalizing behavioral disorders, and externalizing, we're trying to track things like substance use and riskier behaviors, impulsive behavior, aggression. We're trying to be, if we are their attachment figures or we're working with them, we're trying to encourage attachment figures to be emotionally available, even though they might be exhausted themselves, and kind of send that message that they're an askable, approachable resource. And then we're trying to support friendships, even if sometimes that's inconvenient for us to have, somebody at our house, or to drive somebody somewhere, or, whatever. We're going to know that's important, and we'll try to support and prioritize that. I, for one time working with an adolescent, she brought her friend, to therapy, and we worked on activities together, so could be an idea there. I really like this video by Bridget Park, this short TED Talk. Her husband, or her brother, died by suicide, and she goes through kind of all the things she did not like that people said to her, and what she wishes they had said or done instead. She's mad, and I think she's probably just mad that this happened to her and to her brother, and then and it's kind of coming out in some ways as maybe justifiable anger at the, lack of good skills that people were using. So it's a little intimidating to listen to her, leaves me always feeling like worried that I won't get it right, but I also think it's useful. Okay, so in terms of more specific interventions, obviously there's individual and family therapy. Adolescent peer support groups are great because peers are important and you're afraid that you've got this personal fable, no one can understand me, you're prone to maybe some isolation. And so if you're with a group of peers that's kind of counteracting all that, that's awesome. Oftentimes groups involve kind of wilderness experiences or art or music. And so that can be a nice kind of creative outlet as well. But you can obviously be doing all those creative things, music, journaling, workbooks on your own as well. Music therapy you can ask teens to bring in songs that are cathartic or that help them tap into their experience of loss or that symbolize what this person meant to them, or they can even create their own lyrics like rap, to express their feelings. They can do improv, drumming kind of music therapy. My music therapist could probably do this say all this a lot better than me. But even just playing music, singing, dancing can all be therapeutic parts of grieving. Okay, if you want to know more, you can watch this video that features teens at a grief camp. And it talks about kind of their experiences, their manifestations, how grief affects them, what they wish others knew and how others can help, how being with peers can be helpful, and what grief has taught them. So if adolescents don't feel like they have good support, they may end up kind of stuffing their feelings or venting them in less helpful ways. These can be temporary or short-term, or these can kind of be permanent ways of being, more permanent. Nothing's really permanent. But I would say that most adolescents who experience the significant loss of someone close to them do come to terms with that loss and experience, some positive outcomes from surviving the acute pain of grief. And so here's some of the positive outcomes that have been documented in research for adolescents who've had a significant loss. More empathy, more resilience, perceiving more maturity, basically, increased confidence in their ability to cope and survive hard things, increased creativity, and increased importance of spirituality and religion. Okay, well, you've come to the end of another Grief and Loss PowerPoint. Take some deep breaths, let some of it go, think of a way to soothe or take care of yourself that would feel good.